Welcome back, friends. I'm Christine with a K, and this is a series of conversations adult children need to have with their parents. Today's topic is hospice. What do you think of when you hear the word hospice? Hospice is not just a term to use when someone is dying. As someone told me recently, hospice care is a philosophy. Hospice offers comfort to patients and their families by reducing the stress, pain, and other symptoms of a serious illness. It's about helping people live as well as possible when their life expectancy is limited. Typically, hospice is recommended when someone is expected to live 6 months or less. However, there are times when a patient rallies and improves. They are then removed from hospice care but can go back on when their condition declines again. Earlier this year, February of this year, my mom was taken to a local emergency room from the nursing home. She hadn't slept at all the night before. Her heart rate was slightly elevated and she had a low-grade fever. And while I was there with her and I had updated the emergency room doctor on her condition, he asked about hospice care. Had I thought about it? And I had thought about it and I was willing to look into it. Mom had stopped eating at the end of December. She would take water, but we had to hand it to her. And one of the first things the hospice nurse said to me was, she wouldn't have to be taken to the ER again. For nothing else, that was huge. The ER doctor contacted the hospice team that particular hospital has in-house. And so the nurse on duty came down and spoke to me in the emergency room. And when she said, Mom wouldn't have to be taken to the ER again, I was like, sign me up. We're all about that because it's just stressful. She doesn't understand why she's there. And in times of COVID, it's limited to who they let back. And it was so much better to not have to go to the emergency room again. There are 8 signs that your loved one may be ready for hospice. Number 1, frequent hospitalizations or trips to the ER. 2, frequent or recurring infections like a UTI, a urinary tract infection. 3, a reduced desire to eat leading to significant weight loss and changes in body composition. 4, rapid decline in health over the past 6 months, even with aggressive medical treatments. 5, uncontrolled pain, shortness of breath, nausea, vomiting. 6, decreasing alertness, withdrawal, increased sleeping, or mental confusion. Number 7, inability to perform tasks of daily living, such as eating, walking, using the bathroom, personal cleaning, or getting dressed. And number 8, your loved one makes the decision to focus on quality of life instead of aggressive treatment. You need to talk to your loved one's doctor to determine if they qualify for hospice care. There's an evaluation that doctors do, and I believe the hospice agencies have also their own evaluation to see if the patient qualifies. Hospice takes care of not only the physical needs of the patient, but also their emotional and spiritual needs as well. They also offer emotional and spiritual support to the family after a loved one passes. The agency that we used is offering support for my dad, my sister, and I for 13 months after my mom's passing. Our experience with hospice was wonderful. Her hospice team consisted of a social worker who would visit and offer companionship. There was a pastor who visited her a couple of times. And then she also had a couple of nurses assigned to her. The final 2 or 3 weeks of Mom's life, I was getting updates pretty much every couple of days from the team. Any questions I had about her meds or her status, I directed strictly to the hospice team. And besides the medical help, it was reassuring to have another set of eyes on Mom. It was one more layer of protection to make sure that Mom was okay. They were an answer to a prayer, to many prayers that I prayed during that time. Hospice care is an approved is a Medicare approved service. So make sure to check with the agency that they do indeed take Medicare. I hope this helps ease any fear when you hear the word hospice. Their goal is to make your loved one's final days as peaceful as possible. So friends, make sure you subscribe to get notified when the next video is being released, and please hit the like button. Feel free to share my videos with someone that you think would benefit. Summer is coming fast, counting it down on the calendar. Till next time, friends, TTFN, ta-ta for now.